Good morning, friends. Good morning, students. I am back with another video. This is part 2 video of the tryptophan metabolism. In this video, we will discuss metabolic disorders. Now, we will start with the first disorder, that is Hartns disease, right? So, I have written Hartns in this manner, right? So, by this manner, we can remember the chief complaints and symptoms. So, H for it was noticed in the family of Hartns, right? Right. And the chief amino acids are tryptophan, and and Nu for neutral amino acids, right? So Hartman's disease was noticed in the family of Hartman, and there is defect in absorption of A for absorption, absorption of tryptophan and neutral amino acids, right? And the chief complaints are pellagra, P for pellagra like symptoms, right? Pellagra. So pellagra includes three D's, right? D for dermatitis, D for dementia, and D for diarrhea, right? So Hartnup disease was noticed in the family of Hartnup. So name Hartnup disease. A for absorption. There is defect in absorption of amino acids tryptophan. T for tryptophan and U for neutral amino acids in the intestine, right? And the complaints are plague-like symptoms, dermatitis, 3D family, dermatitis, dementia, and diarrhea. And there is also symptoms of mental retardation, right? And ataxia is also there, right? So that's finishes with our Hartman disease. Now coming on to the second disease, that is known as malignant carcinoid syndrome, right? In this disease, the Gentafin cells of GIT, they produce serotonin, right? Right? But normally there is 1% conversion of tryptophan to serotonin, right? But in this disorder, there is 60% conversion of tryptophan to serotonin, right? So there is 60% conversion, and due to uncontrolled growth of these cells, right? So this is known as carcinoid syndrome or malignant carcinoid syndrome, right? And now coming on to the symptoms. First of all, there will be respiratory distress in these patients, right? And since the serotonin levels are increased, there will be hypertension, right? And there will be excessive sweating in these patients, right? So these are the chief symptoms. And now coming on to diagnosis, we will estimate 5-hydroxy indole acetate in urine, right? Right. So normally the level is less than 5 milligram per day in urine, but in this syndrome, the level may increase up to 500 milligram per day, right? So this will be chief diagnostic test, that is estimation of 5-hydroxyindole acetate in urine. But there is some precaution to be taken while performing this test. The person should not take banana and tomatoes. before going this test, because these two fruits, banana and tomato, will cause increase in level of indole acetate in urine, right? So this is the disorder. Now coming on to the third disorder, that is known as serotonin syndrome. It is due to medications, right? Medications for the treatment of depression and seizures, right? So there will be, the patient will exhibit symptoms of restlessness because of the high serotonin levels, right? There will be confusion in patient. Since it is a vasoconstrictor, there will be increase in hypertension. There will be hypertension, headache will be there, seizures will be there, and there will be loss of muscle coordination in the patient. So, in order to treat this, you have to stop the medication, and the symptoms will mostly go away. Thanks a lot. Please like the channel, subscribe the channel, and share with your friends and students. Thank you.